Today, Chantal Walg is our guest in the Coach Me to Lead show. Welcome, Chantal.
Hello. Nice to be.
And yes, I agree. Nice that you are here. And the topic that we are going to talk about, that what your topic is looking differently at healthcare.
That's right.
So, give the listeners, the watchers, a short idea of what is different about how you look at it.
Okay. Well, actually, the current healthcare system is not about health. It's about sickness. And if you turn this around, if you transform the healthcare system into a sick care system, it means a lot. It means a lot for us as professionals in the healthcare system, but it also means a lot for the system and the people who pay for it. So it and transformation is asked if you turn this around. And what does it exactly mean? At this moment, we are only focusing on problems, on sickness, on illness. Um, and what you do if you focus on the health, then you focus more on resilience, more on the power of people. And it really asks something else of us. It asks something about our education. It means different education, but it also means different organization. And actually, all these elements in our system should turn around. So, and the nice thing is we are already working on it. It's already happening. Like this transformation is going on, and I was I was lucky to be there when it started. I was lucky to start in 2012 in the Noordelijke Maasvallei. It's an area in the Netherlands where we really started with what happened with the question, why do we do what we do in healthcare, and is it really healthcare, and what if we start with this instead of looking at the problems and looking at sickness. And it is about 11 years ago now that we started this, and like there is a transformation going on. And I was starting this with a lot of people from different organizations, from the like well-being organizations and the communities, but also like the the healthcare, the bigger healthcare organizations. And well, actually, nowadays we started with positive health, and now a lot of people work with this concept as a starting point in their work.
Yeah, and that's what you call it, positive healthcare.
Yes. Yeah.
And I'm going to give you an example and see if you agree that's what you are talking about and thinking about. I've been working with a physiotherapist practice, and they have now a concept which also I think is the way that you look at it, like a positive healthcare. So not just trying to treat people who have like an issue, like pain somewhere, but try to help them before the pain starts and to become healthy and move and exercise and stuff like that. However, that's the idea and the concept in the mind of the founder and some people, but not everybody. All therapists in the practice are already working like that because you know, they have had different schoolings. Very, like you just mentioned, you have to have like a different idea if you want to think about positive healthcare. So I was there in the beginning of this year. I have an injury on my leg, and I'm a runner. And yeah, of course, when you are a runner, you hate it when you're not running. So you try to fix this problem. And then I got assigned to a therapist, physiotherapist, not somebody who's specialized in runners, but just a one. And he started asking all these questions, and he came up with what he was going to do for me. That was dry needling and some how do you call this, cracking of my bones in my back. How you call this?
Manuel.
Yeah,
Yeah.
and so he did the dry needling first, and then the manual therapy, and then we did some exercises. And they have a really beautiful exercise room. Um, and the idea, of course, is that you then at home continue with the exercises every day. You have to do it a couple of times a day sometimes, but also at least once a day. But doing these exercises every day, that's like a habit, that's a change, that's something you really, that's a behavior you need to change, because it's, you have a different routine in the day, and fitting in these exercises is something that's not easy. Going to the therapist, that's an appointment in your agenda, and you just go and you do the exercises there. But doing the same exercise at home is pretty difficult, and I can tell because I had difficulty with that. And I'm a very habit kind of person, so I should know how this works. I do know how it works, but I also notice now how difficult it is. So I think that something like changing habits is a good addition to, like, just inviting people into the practice, but also, guiding these people during the rest of the week to, train them in these habits. Next to, of course, other steps like preventing being over um, exercised, and preventing these kind of injuries. Is this what you are thinking about? Does this sound familiar?
It's an aspect of what I'm talking about. If you start with positive health and start with human-centered care, then it starts with having a different talk to the person, asking different questions, and you are really looking behind like this problem. So what you do in the beginning when you start with talking about positive health is looking at who's that person and asking you what's most important for you. Most of the times you explain what it is, and there is like a visual instrument that you can use to show and to give insight in what is all about health. It's not only the bodily functions, it's also about the mental well-being. It's about sense making, it's about being participate, being part of the community. It's about all these aspects, and you talk about it with the person who's sitting in front of you as a professional, or like maybe not a professional, but everybody can use this tool. And you ask what do you think about your own health, and what is important for you, what are your values, because that's what you are looking for. It's not only like this is my problem and please help me with this. It's just you try to show people that health is more than this one issue, and sometimes there's more behind that one issue than you even know. People, and even also these professionals, they sometimes are surprised what's behind. So, and after you ask, what do you see, what do you want, what are your wishes, what are your values, then you can ask what do you want and where do you want to go to, instead of what don't you want anymore. We are very used to go to a doctor or to go to a professional and to say, this is my problem, please help me. But that's the one way, that's a one way situation, and it's a one way solution maybe. But when you show people what is all behind, what can be behind this problem, or even when this problem is not going to be solved because it's not possible, because it's chronic or multi-complex, then maybe it's even better just to focus on what do you want. Maybe you cannot, after an injury, you cannot walk 10 kilometers anymore, but maybe the most important thing is that you can go to maybe visit some people, or do like, and make these steps, small steps towards this bigger perspective you want to go to. So it's accepting, or it's looking at your problem, but it's also asking people and see where their motivation is to go to. So that's maybe the biggest difference. And for in your example, it when the healthcare, when the professional or the physiotherapist would have asked you what do you want and what's most important for you, looking at all these aspects, maybe there was something that made you trigger and motivate even more to go to this perspective. I have a nice example of a therapist. She was working with a girl that was has been in a coma, and she couldn't walk anymore. And in the therapy, they told her she had to look for, I think, eggs, to pick eggs with Easter. You pick this, and then she was not motivated at all to do these things. But then when you talk to her, she was quite motivated to dance again. She was a dancer, and she danced from since she was 4 years old. So these therapists, and she made all these exercises on dance moves, and that's what made her, yeah, more motivated and more active to learn and to. So sometimes it's only these small things that make a big difference, and I think this is maybe the most important thing, that where we are talking about when we talk about positive health and working on positive health.
Right. So I have to be clear. The physiotherapist asked me those kind of questions, and what do I want, and why did this happen, and so on. So he was looking into the situation, but I had just difficulty getting into the habits of doing the exercises. It's still not easy. So why are you interested in what happened? What did you study? What did you do? What kind of work did you do? Why are you so interested in this work?
Well, actually, when I was young, I wanted to work in Africa. I wanted to help sick children. But then during my practical periods, and I found out that working in the health care system in the hospitals was not the thing I wanted. I often thought, I'm just carrying water to the sea. I don't know if this is an English verb, but so what I did, I studied health. I was a nurse, but I studied health science in Maastricht, and well, I was focusing more on health promotion, health education, and that's what I did for a long time. And I believed we have to learn individuals how they can take more care of their health and what they can do. But then after, like now, I'm more convinced that we should look for health in a bigger perspective and more integrative with other problems, with the context, within the context. So I agree we should take care of people that, or maybe support people to do these individual moves, but also look at the environment and look at the context. Because when people live in poverty, when people have not enough education or do not understand things, then it's hard to create health. And I think the main thing we should do, or the first thing we should do now, is create health. And by supporting this social basis and a healthy basis, and try to help people to make the right choices, to make the healthy choices as well. So actually, this is my transformation from sick care to maybe more prevention, more healthy living, to maybe more creating a society that's more supporting. Because nowadays the big health gap, is actually also the poverty gap. So I think we should, and that's actually also why I'm like relating and feeling related with the inner development goals.
Hold on
Yeah.
before you go there. So why is there the relation between the health care and the wealth gap?
And why?
Yeah, why?
well, when you're not sure about whether you have enough money to buy food, or when, then actually there is evidence your brain is not working that well anymore, or your EQ is
Yep.
going down.
Yeah.
But
13 points it drops about.
you
Yes.
know it exactly. Yeah, that's true. There's a nice book about this. It's written. I'm not sure about the write the names, but it's a nice book. Um, so it's really hard and really difficult to focus on these individuals, and to focus on and tell them you should lose weight, you should smoke less, and when they live in, like, in this in with these problems, with no money, the first thing you have to do or have to worry about is having enough food, or having work, or and not the stress. So we have a lot of people that have these problems. So I think this is the first step. We should start in healthcare. We should start with creating health for all the people, and have like a common floor. So when individuals need more help, they should get more help, and when they get sick, they should get help in the hospitals, or wherever. But I think we sometimes forget to start with a social and a healthy basis. So that's actually
Yeah, and that directly relates to the SDGs, the Sustainable Development Goals. At the moment, there is still 750 million people living in poverty, living below the um, wages that the SDGs say, the UN says is what's normal, what's the minimum, which is $1.95, I believe. There's 750 million people living below that, and the question, of course, is that number high enough? Because I think living just off $2 a day is still not enough to have like a healthy situation, healthy in the finance situation then. And the talk about this idea of losing IQ when you are feeling this shortage of money, it's really weird, because the investigation, the research on this is any shortage, when you focus on shortage, your IQ drops, and you are so focused on the shortage, there's no space in your brain to think about other things. So you just focus on what can I do on the short term to fix this shortage. So you're not looking at the long term anymore. So if you're looking, for example, like you just explained about health, it is a long-term thing that you're looking at, right? You're looking at what do I do daily to improve my health in the long term. And if you just focus on shortage, whatever that may be, money, but it can also be like food, it can be
on
so many
time.
things,
Yeah,
time,
yeah.
right? Then it's going to be very difficult to look at things, how you can do this for the long term. So if you look at this, before we go to the IDGs, what do you think about it? Because Coach.me, the platform, the whole thing is about habits. It's about creating habits. It's creating habits, better habits. What do you think about the relationship between habits and health?
Well, there's a lot to it. Actually, I studied health promotion and education, so this health, this behavior is an important thing. And I was taught that the ASA model, I don't know if you know it, but that you have several things that influence behavior, like attitude, social influence, and self-efficacy. And this leads to intention, and when you have the intention, then there is a probability that you will change your behavior. And this was a very important model. And nowadays, they also see that changing this so that starting with the behavior, not waiting to have these influence things on the right level, but starting with the behavior by, for example, challenges, makes people feel and experience what it does to have this behavior, and that this way, like starting with the behavior, is maybe a very good idea to change behaviors. For example, like the 40-day ik pas, it's like in January, it's dry January, like 40 days you don't drink. People experience that they feel better when they don't drink, that they have more energy, and like this way makes people change maybe their behavior even more than like the health scientists thought, of the behavior scientists thought before. Like sometimes just doing things or creating a context where people do these things. I have a nice example, for example, from the United States. Behavior there is that they do these bingo or lotto, and what they said, they wanted to change the behavior to the environmental thing, like the putting glass into the boxes, like I don't know, like the glasboxen, of the glasbakken in the Netherlands, it's called.
Right.
And what is
Recycle.
recycle, yeah, to recycle this glass, but it was hard to get them to throw these glasses in these boxes. So they said, okay, what we do is we tell people they can win something when they put their name in this glass and put them in the boxes. And they did this for I think a year or something. And people, they started walking to these boxes, and at the end they it was kind of a behavior, like they were nudged to do so, but it made them doing it, and it became a behavior, natural behavior. So sometimes, and I think this is, find it interesting because it makes, for also for the public health, it makes it important to think about not only focusing on the individuals, but also on the the public and the collective component. Yeah, that's, I think, one of the things that I lately found out that is also very important.
Yeah, I've read a number of books about habits, and I think people love to change to good habits, but we make it too big, so that's going to be very difficult to tackle. So when we create tiny habits, which is a well-known formula, um, then it makes it a lot easier to get used to something. So let's say, for example, you want to run more, and people say, okay, I want to run 10K. But it's if you haven't never run before, or if you like overweighted, then it's going to be very difficult to run a 10K in one go. It sounds not even 5K. It sounds not like a lot, but if you're not used to running, it is quite a distance. And the thing is, if you start by just putting on one running shoe every day, that's a great start. And it sounds really weird, by just putting on one running shoe, but there's going to be just a couple of days that you're going to be putting on two, and then just a couple of another days that you think, okay, I will just go outside. Even if you just go outside with the running shoes and just go back in, that's just the start. I remember this great story that was in the book. I think it was in the book of Wendy Wood, Good Habits, Bad Habits. I'm not sure. Where this person wanted to go to the gym to exercise like every day for an hour, but this is a huge hurdle to take. So this person started just going for the first week, just going to the gym. So he was an American, so he drove by car to the gym. He was in the gym maybe for 1 minute, and then he went back home. So he didn't do any exercise in the first week. He just went to the gym, so that this part becomes a habit, a rhythm. And then later on, it changes to just doing an exercise for 5 minutes and then stop and go home. So you have to make it really small. So if you want to change your health, yeah, I think breaking it up in really tiny parts, that's a good thing to do to to improve your health on any level, right? Even the social aspects, right? So there's so many levels that you can do this. Um, what do you feel about, and because the way I've heard it, but I'm not sure if it's really the truth, but the way I've heard in the Eastern, so in the Far East, um, there's a lot more focus on health. So people pay the doctor in China when you're healthy, and you stop paying when you're sick, because that's the job of the doctor, to prevent that you become sick. And here in the Western world, we pay for people to cure when you're sick, and there's a lot of money to make from that. So there's a lot of money going to insurance companies, to all these professionals in the healthcare, which is lost in bureaucracy or registration or all this stuff that's not really taking care of the health of people. Do you see that? Have you experienced? Do you see the big difference that I've just mentioned with the Eastern health and the Western kind of health?
Yeah, sure. We get paid to take care of sick people, and that's a different. That's not what they do there. I think that's exactly what we have to change. We have to value more the health and taking care of the health instead of sick people. But actually, this is how we all earn money in our system. Just we earn taking care of sick people, and we don't earn. There is not a value for, or we don't value enough. That's actually the exact question I always ask: is what do we do in healthcare? Why do we do what we do? And we say we take care of the health, but we don't take care of health. We take care of the sick, and we should take care of sick people. But is it where we have to start? I think now we are only working on the symptoms and not taking care of this bigger picture, and not making this ground for everybody a healthy ground. And I think there's a nice expression, or it's like one sentence. One of the scientists says, he says, sustainability is personal health and planetary health. So we should really take care of both. And the one will not exist without the other, and will not. And actually, sometimes I think it's more the resilience. Sustainability is
Mm.
maybe something that it's more almost a contradiction. We everything changes every day, so but we cannot create a resilient society if we don't take care of both, so, personal and planetary health. So
Yeah. So coming back to this different way of looking at it in the Western world, is there was a flaw in this whole idea, because if we keep you sick, or if we make you sick as a society, we as society make a lot more money, right? So the first, the people who sell you stuff that makes you sick make money, then the people who try to make you better make money. So making people sick is a revenue driver, is a profit driver. So it's a flaw, it's a trap that we are just, I think it's going to be very difficult to get out to, because all these pharmaceutical companies, and also these um, companies who make food, for example, well, if you would call it food, um, they both make a lot of money, and they became so huge that it's very difficult to, they have so much influence in the world. It's going to be very difficult to break this system. How do you think we could move away from all this focus financially on sickness to, and I think it's a very difficult question, by the way. I understand it's not easy to answer, but I want to hear how you think we could do this, to find a way to make people, to make a living as a professional, to help people to stay healthy. Because if I'm a um, patient, which is not the right word, but if I'm a patient and I'm healthy, what would be the reason for me to pay the professional, right? So, how can we make this work?
Well, it's a big question, but it's an interesting question because I think it's exactly the point that we should work more integrative within all those SDGs, because it's the way we look at our economy. We want growth. Growth is the most important thing. In Holland, we have Kees Klomp. He's busy with value economy. I think this is the English translation, but um, we should. So it's all integrated. If this changes, that growth is not the only thing, growth in the economy, then probably everything will shift or change. And so it asks what it is asked. It's a paradigm shift. It's a shift in our mind shift, that what's the most important thing and what do we value most. And that's actually, I don't know if you already want to talk about the IDGs, but that's actually what I think is the nice thing about working with the IDGs, because these can this is like the glue that can glue all those complex, fragmented issues together. Because then the first question is, what's the value, and what we have in common, like what Kees Klomp does with the value economy, what we do with this from sick care to healthcare, and how we want to start within the communities. Actually, everything is. We separated everything, but it is. I know it's complex. I know, but I don't think we can solve the problems separately. And I think talking about them with people from our inner from our inner motivation, from what we want, that's what I also experienced within the hub. That will make us solve these complex problems. I am sure. How difficult? I know it's very difficult, but I think we should not see them as one issue problems. The crises are not. I mean, when I'm not healthy, I will never. When I'm not feeling well, when I'm living in poverty, I will never set my mind on um, green or biodiversity. I will not. I mean, so everything is integrated. We should take care of everything together and solve them together. Maybe I am an idealist, but I've seen these last 11 years that when you start with something and you believe in it, then there it's maybe not a real big change, but there things change. When I started with talking about positive health, when in 2012 2013, people would think, what are you talking about? And now I mean, now there are a lot of organizations and people working with this concept and working on healthcare and prevention. And although I think prevention is not far enough, we should go more basic to what I call core, creating health and healthy and social basis. But so I believe we can do this, but we have to do it together and not staying in our own sector. So
Yeah, and to be clear, the SDGs mentioned before is the Sustainable Development Goals, and the IDGs is the Inner Development Goals. So Sustainable Development Goals were set up by the UN and signed by 139 countries in the world. It's about improving and working together, keeping people out of poverty, no hunger, but also clean water, clean air, biodiversity. So there's a lot of elements, 17 goals in there with all kind of sub goals. And it is sometimes very difficult to understand what you can do as an individual or as an organization to on the SDGs. So a separate thing started with more than 1,000 scientists from all over the world, at the moment mostly Western, but still all over the world, that look at, so what are the skills that we need as humans to contribute to these SDGs. And they came up with 23 skills and divided into 5 domains, going from being to action. And I believe in these IDGs, and so do you. And we start with ourselves. Our inner development is the big start to make the change towards a better future, for all of us, for the world, for every being that's on the planet. And that's really important to make this shift. And when you look at the 3 elements that most people know, right? Planet, people, and prosperity. I don't say profit, I say prosperity. That's, I think that's the triad that we're looking for, right? So we're looking that we should have these 3 in balance. It's not about just profit, because that's what got us in this trouble that we are in at the moment in the first place. So we have to, let go of this idea that we need to grow in profit every year. It's not sustainable. So we look at, so if we bring this in balance, right? Planet, people, and prosperity. So this gives us the opportunity to look at, so what can we do as an organization, as a human, to contribute to a planet where we all can live, not just the humans, but also animals and all kind of non-human animals, as Peter Singer says. And also, how can we take care of other individuals? How can we take care of communities? That's people. And then, of course, we need to have a living. We need to know what is enough. When do we have enough in the Western world? And how can we make sure that we bring these people at the mostly the southern hemisphere along with, who have not enough, right? They still need to grow to a level which they experience well-being, because they are not at the level of well-being at the moment. I'm talking a lot, I know, because I think it's really, really important that you understand that this is the triad that we're looking at. Profit is not the one, it's planet, people, and prosperity. So that's why I also invited you to this episode. That's why you and I believe in the IDGs. And I think it's wonderful how you explain the importance of looking at health and not just sickness, and the way that you see health as a larger picture with everything involved, is and how you are in your community, how you are on wellness. Everything is involved, and not just, you go to the hospital and you feel sick and somebody's going to, fix you up, and give you medicine or give you an operation or give you a new leg, which of course at that point is important, but still, that's something that you want to do as a last resort. All this other stuff should come first. Um, what's what can you tell us a little bit more? Because you talked about core, you say core, cure, care, and back again. So what can you tell about this whole idea that you have here?
Well, I work a lot with general practitioners and people in healthcare, and when they have this conversation with their patients or with their clients, with the people, then they most of the times they look at the problems, and when there's a problem that they can cure, they treat it. When they can prevent this problem, then you call it prevention, and you have some interventions on that. But if you have a conversation with people the way I explained earlier, then it's possible you look at the perspective as well, perspectives. And when you look at the perspective, it asks it you need a different way of working on that. And actually, there's no word for it. Like, we don't have words for, sometimes we call it pre-care, but it's not pre-care. If you want to support or create health, then there's no word for it. And I know core is it's the inner of our world, and it's a verb. It's not a verb, but I made a verb out of it, so we can actually act on it and say I can create, or uh, and and it's nice, like you can say core core care cure. And also care, I think normally we make this position, we put it when people are sick or when people have problems, we take care. But I think care should be in the middle of everything. We should take care of people from perspective without, when people have no problems. So we should take care of each other, and we should take care of each other when we are sick or when there are problems. So care is uh, more we should take more care of each other, because that is, I think, also a very important aspect of creating a resilient society. So
And I agree. And I have. I'm always thinking also about examples that I see that happen in my area, in my neighborhood. So my neighbor, he had a broken hip, and I hear that's, and just after a couple of days, I went over and visited him, and gave him some books that he could maybe read. He just brought back the books. It's been 3 months ago, and yeah, and I think it's important. But also at the same time, the neighbor on the other side of the street, um, I've heard that he's sick for a longer time, and I didn't ring at his door. So I'm not saying I'm the good person, because I also miss opportunities and don't pay enough attention to these kind of things. But just doing this is really important. And the weird thing, of course, is that if you're looking at the national growth, the growth numbers, right? So the growth numbers that the companies, or not organizations, countries use to indicate if we are growing as a country, if we are making enough um, growth, and if there's enough innovation. These numbers are added up all kinds of information, like how much we sell, but also if we produce war equipment, it adds positively to this number. And if we sell care, adds positively to this number. But if we, for example, take care of our parents for free, then it doesn't add to this number. So that's really weird, because if you would add the same time and you would sell it to your neighbor, it would add to this number. So it's we have kind of weird ways of looking at how we feel is well being, right? So we look at how much money we make, but that's not how we feel. It's not about well being.
yeah, that's what I think is very important, to talk about what we value, and that we realize that there is, even if you ask somebody who is dying, what's the most important thing that in your life, it's not the work, it's the family, it's people around. And so why don't we start valuing these things more? And um, yeah, well, I think we will get a more resilient and more happy society if we do so. But we should start talking about this and not see it as a soft thing, or as a less important thing than growth and money. I mean, we should see, and that's maybe a nice thing, because they valued it in money not long ago. That's where you refer to, I think. They valued it in money, the taking care of the family, taking care of your father, mother, and it's a lot of money. And so so this valuing is maybe a transition way to really see how important it is. We did it. My colleagues from the organization where I also work for, they did it with the healthcare professionals, general practitioners, they ask them, how do you value this in money, like the way you work? What is it worth for you? They valued it in money because they said, actually, it's worth 30,000 a year for me, the working this way. And then you can say, this actually you don't want to value it in money. But then if we see this discounting, this number, we may act on it. And maybe it's a transition way of doing. Hopefully, at the end, we will all notice that a specific way of working, having more time for your patient, or having other questions to ask is just good, and you should do. But now we are in this wave, we don't know yet. So okay, we value it with a number.
Right.
Yeah. Yeah.
Okay, so going to end this conversation. And before we do, I want to make sure that if you have questions and you think this topic is really interesting for you and you work in this health sphere, maybe you can find Chantal on LinkedIn. And like I said, this is the URL, and you can see the image in the background. But if you want to make it even easier, you can go right here. If you click the QR code right there, you make a photo of that, then you go directly to her profile, which is in Dutch, but that's okay. You can just send her a message or connect with her, and she will reply in English, of course, obviously. So even if her profile is in Dutch and you have questions about this, just feel free to connect with her, contact her, send her a message, and and she will tell you a lot more about this. And I think it's a really important topic. It's especially in the Western world, because we are far away from looking at this in a healthy way, to misuse the word. So I thank you, Chantal, for first of all doing the work, making the professionals aware of this. My daughter is also a nurse. I send her your profile saying, okay, follow her and learn about what she's telling. And and thank you for sharing with us how you feel that we as individuals, but also organizations, can work in this transition. Thank you.
You're welcome. Thank you.
Okay, let's see what I want to show you now. Still is okay. Next Friday, same time, same place. So if you are in Europe, Amsterdam time line, that it is 4 o'clock, 4 p.m. If you are Central US Central Time, it is 9 a.m. And I'm looking forward to see you there. And next week, it will be Kendra Kinnison of Coach.me, the CEO. Thank you very much, and see you then.